We need to talk about the health care crisis going on in the country. Right now, millions of Americans are forced to choose between buying food and buying medicine. There are kids who can't afford to see a doctor, adults who have never been to a routine checkup. President Obama's Affordable Care Act is helping the crisis. Today, we learned the law saved consumers nearly $4 billion in premiums last year. A new study finds that in the 9 states that have publicized insurance rates under their exchanges, every plan came in cheaper than estimated. And today, we also learned the growth of medical costs is falling for the first time since the 1970s. No question, these are positive signs. But right now, some on the right are still blocking a solution. Republicans in 21 states are blocking the expansion of Medicaid. Let me be clear. They're blocking uninsured residents from getting access to care, literally turning down money for the poor. How can they look in the mirror at night? We should all be in this together, helping our fellow Americans. So we are taking action. We're proud to partner with the National Association of Free Clinics. On July 3rd, Politics Nation will be live from a free clinic in New Orleans. Joining me now is Nicole Lamoureux, the Executive Director of the National Association of Free Clinics, our partner for a free clinic July 3rd in New Orleans, and Richard Wolff, Executive Editor of MSNBC.com. Thank you for being here tonight.
Thanks, Reverend.
Thanks so much.
Nicole, today more signs the health care law is working, but we see some putting politics over people. I mean, who are the people that you see coming to your free clinics?
Rev, the people we see come into our clinics are people who work every day. 83% of our patients come from a working household. The last clinic I was at, I saw a man who hadn't been to the doctor, and he was 40 years old because his employer wouldn't let him get health insurance. That shouldn't happen in this country. We're not a third world country. We're America. We're the best place. We should all have access to affordable health care. It should be a right, not a privilege.
Now, what kind of needs do you see at these free clinics like the one that we're going to do in New Orleans July 3rd?
We see everything from physicals. Kids need physicals to get into school. You know, substitute teachers need those physicals so they can teach.
Right.
We see people who need physicals to get back to work, construction people. But we also see times where people have breast cancer and they come to us. People who have heart attacks and we send them to the hospital and save their lives. Everything you can think of, we'll take care of that day.
Richard, is the politics changing on this at all as we see things go forward toward this law going into full effect?
Well, they are changing because you are seeing, although there are all those Republican senators who are holding out against Medicaid dollars, a number of them are falling down. The dominoes are falling. And yes, you're seeing an impact on the industry. And there are lots of people in the industry who don't want to see things change, but are saying we're going to have to adapt. That's why you're seeing these cost measures. You're seeing employers change what they do. This is having an impact now. But, you know, I've got to tell you that it's not going to be enough. And that's exactly why these free healthcare clinics are so important. You know, this law was not defined and designed for the working poor, the people that Nicole was just talking about. So
right.
If we want to see healthcare change, we have to take action on ourselves. And I'm going to call out our own website, tv.msnbc.com. Go to the Politics Nation page, to your page, and there's a button there you can click and help out with these health clinics right now.
Now, let me ask you this, Richard. We all know Arizona Governor Jan Brewer is not exactly best friends with the president, but she did sign Medicaid expansion this week and said this. Listen to this.
I want to recognize the lawmakers who made this moment possible. They displayed something we don't see a lot of in politics today, and that is courage.
And today, even Michigan Governor Rick Snyder told his fellow Republicans they should take a vote, not a vacation, because they failed to vote on Medicaid expansion. So there seems to be some movement by some Republicans, Richard.
Yeah, look, it's inevitable. Honestly, they're going to get all the benefits, these Republican governors, they get all the benefits by saying, we don't like Obama, we oppose this thing, we think it's a terrible use of money. But they get even more benefits if they actually help their voters, if they help people get these health care benefits that are going begging for them. So, look, Jen Brewer is not a friend of the president's. She has been very upfront, very aggressive with him, and yet even she realizes this is someone who could barely get talk her way through the first 2 minutes of a TV debate. And even she understands that this is completely the right thing and a logical thing and a politically successful thing to do for her and her Republicans there.
Nicole, take me through what are people's needs? What are the kinds of things we're going to see at the free clinic in New Orleans July 3rd?
The first thing we're going to see is that many people haven't been to the doctor in more than 5 years. For many in New Orleans, they haven't been to the doctor since we were there the last time with you all here at MSNBC. We see people who just want to get access to health care, and they have nowhere to go but the emergency room. New Orleans was hit hard after Katrina. Then we had an oil spill. Then we had flooding. These people need help. They want help, and that's what we're going to be able to give them.
Richard, you have the conspiracy theorists that will come out when nothing else works. They try to scare people. Rush Limbaugh has a new conspiracy on the health care law. Listen to this.
Purpose of Obamacare got nothing to do with your health. It has nothing to do with your insurance. Democrat supporting groups are being given millions of dollars to promote the Democrat Party. Register Democrat voters. Get them to the polls on Election Day. And the purpose? To set up a permanent one-party system in this country.
Now, in California, you'll be able to register to vote when you sign up for insurance exchange. But some nonprofits are getting grants to explain how the exchanges work. But some on the right are saying this is a secret plot to create a one-party system. I mean, Richard, what do they think will come up out of this? I mean, I just can't imagine what they will come up with next.
No, I thought registering to vote was a good American thing for democracy, right? I mean, you're not registering to vote for a president. You're just registering to vote. And that should be in everyone's interest. There are Republicans who also need health care. And I'm surprised that Rush Limbaugh, who likes medication of himself, he seems so skeptical about this whole program.
Yeah, and it doesn't matter what party you're in, where you lean politically, these free clinics will service you, and all are welcome to New Orleans with us.
Exactly, absolutely.
Nicole and Richard, thank you both for your time. Nicole, we look forward to seeing you on July 3rd. I want to take a moment, though, to talk directly to the Politics Nation family out there. It really takes a massive team effort to provide these free clinics, and we need your help. I'm asking everyone to find it in your heart to please donate. If everyone just donated $1, it would make a difference. Just $1. You can go to urgentcare.msnbc.com or the National Association of Free Clinics site, nafcclinics.org. With your help, whatever you can do, we can make a difference and get health care to so many Americans in need.